Hello friends, good evening. This is Dr. Manjunath, your FMT Guru. Today we are going to discuss important long essays, short essays and short answers from Toxicology 2. In yesterday's class, we discussed in detail about organic irritant, especially the snake bite, and also the Organophosphorus poisoning. Yes guys, I'm audible and visible. Menak Datta, Aditya, Rakesh, Tanya Sharma, hi, hello everyone. Okay. As I discussed in previous class, 25% of total questions in forensic medicine do come from toxicology. The usual question, that is opium poison or it is snake bite. Sometimes the main question can be from carbon monoxide also. Carbon monoxide or cyanide poison, because they are very common. So the most expected question from toxicology, the one is opium poison, the second one snake bite, carbon monoxide poison and also cyanide poison. Most expected 5 marks question usually from arsenic or sometime from lead, mercury also. Okay. All good Rakesh? All well? Fine. That's okay. Now let's start. Here is the scenario. The scenario is a case of murder. 103 BNS. A man dies after weeks of diarrhea and weakness. So diarrhea basically because of the gastroenteritis. Weakness because of the dehydration, circulatory shock, hypotension. His hair and nails were preserved. The wife was very calm. She was very calm until her browsing history revealed how to poison without smell. बिना गंध के किसी को जहर कैसे दे? This was her Google history or ChatGPT history. The patient came with a history of rice watery stool, gastroenteritis, died due to hypotension. Can anyone tell me what was the poison used in this condition? Space, Kiran, Srimati, Ashutosh, Manak. Beta, what is the probable poisoning in this case? The answer is arsenic trioxide. It is not arsenic sulfide. It is not copper arsenate. It is not Scheele's green. It is not Paris green. It is arsenic trioxide. It is a colorless, tasteless, odorless compound which can be mixed with any food and drink. That's why arsenic is also known as inheritance powder. King of all poisons, that is arsenic. All of you write in the chat box, the king is arsenic. We discussed yesterday, king is arsenic. King, Raja is arsenic. Queen, Rani, aconite. Okay. King of all kings, Chakravarti, we can say king of all kings. King of all kings. Basically, thallium. All of you write in the chat box. King is arsenic, the queen is aconite, and king of all kings, thallium. Try to remember arsenic poison, Aldrich means thallium poison, Aldrich means line. So very important MC. Aldrich means line seen in various conditions, not only arsenic but also thallium. Please write this. Okay, neat flex, beta. Okay, fine. In state like Karnataka, exam do start from September 8th. Almost 1 month is there. Okay. Srimati, Bhumika, Glycothallium is king of all kings. Okay, that's okay. Now let's discuss about arsenic poison. 5 marks question. When I talk about arsenic, I remember one very famous king, the king Napoleon Bonaparte. Okay? You can see here Napoleon Bonaparte. The Napoleon Bonaparte, he was killed by his own servant. His servant used to mix arsenic, especially arsenic trioxide, every day with his food and drink. He died due to chronic arsenic poison due to stomach cancer. The analysis of his hair and nail showing almost 1000 times more than the normal level. So the cause of death in Napoleon Bonaparte is arsenic poison, chronic arsenic poison leading to stomach cancer, leading to neuropathy, leading to abdominal pain, all other clinical features, even anemia also. Like example, raindrop pigmentation, Aldrich Means line, so or erythromelalgia, stomach cancer, skin cancer, bladder cancer. All these are features. Napoleon Bonaparte. Okay. Oh, that's okay. That's fine. So the mnemonic is Bonaparte itself. Bonaparte RRR. What is the mnemonic? Bonaparte RRR. Please write the mnemonic. I'm going to discuss about B. What is B you want? Very simple actually. B for black food disease. Just write Bonaparte RRR. Napoleon Bonaparte. So that is arsenic poison. Black food disease is basically because of the vasculitis. Because of vasculitis, there is a formation of gangrene. Black food disease. O for oxide. What is that oxide? Arsenic trioxide, which is known as Sankhya Somalkar white arsenic. What is the fatal dosage? 120 to 200 milligram or 2 mg per kg body weight. What is the smell? Garlic odor. O for oxide. That is Sankhya Somalkar. Neoplasia, it can lead to cancers. What cancer? Skin cancer, lung cancer, bladder cancer. It also affects the nails. So N for nails, N for Aldrich Means line. It also affects the hair. There can be alopecia. Alopecia can be seen in case of thallium poison also. A for alopecia, anemia, Addison-like disease. Addison's disease. It can be found in ashes also. In the bones, ashes also. It is aphrodisia. It is used as a substance to increase sexual desire. Arsenic preparations. A for abortion, A for apoptosis. Arsenic causes apoptosis, it causes cellular death. Fine. Then P for peripheral neuropathy. Again, question asked. Neuropathy seen in case of arsenic poison. What type of neuropathy? Neuropathy is basically mixed neuropathy, causes motor neuropathy and sensory neuropathy. It commonly affects the distal muscles like forearm muscle, leg muscles, not the proximal myopathy or proximal neuropathy. So glow and stalking. Then A for Aldrich Means line. Aldrich Means lines are the white color lines seen over the nails. All are very important points. Okay. Now discuss about the 5 important images. Look at the 5 images there related to arsenic poison. Bonaparte we discussed, up to P we discussed, up to A we discussed. So now these 5 images, can you just identify the 5 images related to arsenic poison? A क्या है बताओ? A क्या है? B क्या है? C, D and E. कौन बताएगा? देखते हैं. मेनक दत्ता, भूमिका, श्रीमती, Dhanya Sharma, Rakesh. Can I identify these images related to arsenic poison? The first image basically black food disease. black food disease. The second image, Sankhya or Somalkar. The third image, Aldrich Meesline. And this is Scheele's green. The Scheele's green is a combination of copper and arsenic. It's green in color. It is used as a coloring agent. And this is Paris green. The Paris green is stomach poison. It is used as larvicidal in mosquito control. So 5 images, 5 important points. Black foot disease, Sankhya, Aldrich Meesline, Scheele's green, Paris green. Okay, good. I think Tanya Sharma, very good. Tanya, excellent answer. Menak Datta, बहुत बढ़िया, good answer. Rakesh, are you there? Can you answer this question? Oh, yes. Okay, हो गया. Now, continuation of the Bonaparte RR. R for rigor mortis last long. So rigor mortis means stiffening of the muscle after the death. That lasts longer than the 12 hours. It retards putrefaction. Putrefaction caused by Clostridium welchii, that is inhibited by arsenic. Arsenic is a heavy metal. It is basically bactericidal. Yes, then teratogen, arsenic poison also can lead to some developmental anomalies in the fetus. Teratogen hai. Enteritis, it causes gastroenteritis. Rice watery stool, it resembles like cholera. MCQ, cholera resembling poison, arsenic. Tetanus resembling poison, strychnine. Metal fume fever caused by the heavy metals, other heavy metal like zinc and all. Metal fume. It also causes endocardial hemorrhages. Raindrop pigmentation is a very important feature. Sometimes rash can be seen that resemble like a measles rash. R for red velvety stomach. Because of the arsenic, there can be congestion of the stomach, there can be ulceration of the stomach, there can be micro bleedings. So because of that, it looks red velvety stomach. Then rinse test, Marsh test, Gastric test, all these are the tests for the arsenic poison. So all these are important points about arsenic. So what are the investigations? What are investigations in case of arsenic poison? So nowadays we have advanced investigation technique, like example, neutron activation analysis. Neutron activation analysis is a good test, and other tests as well. The name tests are Marsh, Gastric and Ringe. They are outdated. They are not used nowadays. The treatment. Can anyone tell me what is the treatment of choice in case of arsenic poison? The acute arsenic poisoning, chronic arsenic poison, the treatment is same. The drug of choice, very good drug, chelating agent, which has a sulfhydryl radical, which combines with arsenic, which forms the water soluble compound. What is that chelating agent? Srimati, Menak Datta, Rakesh, बहुत बढ़िया, बताओ, जल्दी बताओ. The answer is BAL, British anti-levisite. Remember, BAL is given intramuscularly, orally, never intravenously. Why? Because it consists of peanut oil. Peanut oil leads to fat embolism and death. That's why BAL is given only intramuscularly orally. And again, nowadays we have analogs of BAL. We have DMSA, DMPA, and all. That also we can. And one more question asked, BAL is contraindicated in. So BAL is contraindicated in iron poison, cadmium poison, and organic mercury poison. Organic mercury. So in all these conditions, it is contraindicated. Iron, cadmium, organic mercury, peanut allergy. Okay. So this is okay. BAL is the drug of choice. So please write in the chat box mnemonic BAL is equal to PICO. PICO. PICO is a mnemonic. P मतलब peanut allergy है, I मतलब iron poison है, C मतलब cadmium, O मतलब organic mercury. Ball is equal to pico. Try to memorize this. Pico, pica, pico, and all you know. Okay? Keep writing. Srimati, others. Pico. So this is overall picture about the arsenic poison. See, arsenic poison presents with the rice water stool. It resembles like cholera. Lead poison presents with the facial pallor, constipation and pain. Mercury poison presents with the tremor. Okay? So like this you can differentiate. Copper poison presents with the KF ring. Liver cirrhosis, again tremors. Dementia, that is basically caused by the aluminium. Heavy metal poison frequently asked. Okay. Ball is equal to pico, all answered. Bhumika, very good, that's great. बहुत बढ़िया. Now देखते हैं. Now images are there. Again there are 5 images are 6 images. Now can you identify related to arsenic poison? देखो one by one. What is 1? 3 क्या है? What is the importance of that? 4, 5 and 6. जल्दी बताओ ये क्या क्या है? Image number 1 is raindrop pigmentation. ये क्या है बताओ? Raindrop pigmentation, RDP. Image number 2, red velvety stomach. Red velvety stomach. Image number 3, garlic smell during post-mortem examination. Image number 4, erythromelalgia, redness, erythromelalgia. Image number 6 or 5, basically it found in the dead body. Dead body, even in the bones. Not only in the bones, hair, cartilage also, nails also. And 6 is basically ball, British anti-levisine. All are 6 important MCQ. So ball is usually a chelating agent, consists of 3 carbon atoms, 2 sulfidal radical, combines with the arsenic, makes the friendship with the arsenic, it makes it water soluble. Once water soluble, it gets excreted in the urine. So the best friend of arsenic is ball. Ball is a very good friend of many people, so including copper, including lead also. Ball is a very good friend, social man, combines with many heavy metal poisons. So Menak Datta answered very good, excellent answer. Menak Datta, बहुत बढ़िया, excellent, great. तान्या शर्मा, एरिथ्रोमेलाजिया, बहुत बढ़िया. श्रीमती शिव कुमार, मीस लाइन कहाँ पे यार? मीस लाइन तो नहीं है इसमें. Garlic order, Rafana is telling sir garlic, very good, बहुत बढ़िया. All are answering. Okay, good, very good. चलो आगे देखते हैं. Now one more 5 marks question is a difference between arsenic poison and cholera. Very very important. So just go through this table after the class. Go through this PDF. So what are the features of arsenic poison? What are the features of cholera? So write more tables, more diagrams in the exam to get distinction. There are features like pain in the throat, purging, vomitus and all. Very simple, you can just go through that. Okay. Now can you identify this? So this is the case of homicide where arsenic is mixed with the maza juice. Maza पता है ना आपको? Mango juice. Arsenic was mixed and person found dead. During autopsy examination, there is a finding is there. Entire stomach is red. Matlab, what is the finding? Maza juice. What is the finding, guys? Answer is red velvety stomach. Red velvety stomach. Okay. This is how we examine dead body in postmortem. Okay. Garlic smell, red velvety stomach, unusual behavior of the wife, unusual behavior of the husband, girlfriend, boyfriend, some motive, some property motive, friends, sudden death. So postmortem is conducted as a part of inquest, as part of 194, or if it is dowry death, 196. That's why forensic is very interesting. Forensic is very important in court of law. It is very important, is a part of the investigation, police investigation. So as a doctor, as a forensic expert, so we can help judiciary Knowledge is very important. Your knowledge is your power. You agree with me, guys? What is your opinion about it? What is your opinion about forensic medicine? Is it interesting? Is it boring? Or is it okay? Or it is very important? What do you think? I said maza juice, red velvet is how good it is. Okay, हो गया. This is okay, fine. Now that's fine. Next important question. Okay, we're not going to waste any time. So without wasting any time, we'll discuss about one more important poisoning, that is basically Datura poison. Datura. Datura is basically thorn apple. क्या बोलते हैं हम लोग? Thorn apple. Apple is very good. Thorn apple is very bad. Thorn apple physostigmine treatment. Apple very good for health. Except apple seeds. Apple seed consists of some amount of cyanide. We discussed in last class. Thorn apple बहुत बढ़िया. देखिए ये देखते हैं क्या है, ये किडनी शेप्ड सीड्स हैं. Datura seeds. Datura is a deliriant. It causes disturbed consciousness. Kidney shaped, double edged, then brown in color, very fatal. It causes delirium. It causes drowsiness. So Datura seeds. What is the fatal dosage? Fatal period. Clinical features. Active principles. All are important questions. Fatal dosage, it depends. Depends on the gastric lavage, type of food. 6 to 12 hours. Up to 24 hours. Fatal dosage 100 seeds. Clinical feature 9D manifestation. 9D clinical feature. Principle, it consists of hyoscine, hyoscyamine, and atropine. Okay. So it consists of atropine. So atropine is an inhibitor of acetylcholine. So it causes weakness of parasympathetic system. So it causes dysphagia, dysarthria, delirium, disturbed consciousness, death, dilated pupil. So many features are there. Okay. Treatment. The treatment is gastric lavage, activated charcoal, physostigmine. Physostigmine has various side effects. You must be very careful while giving physostigmine because it has serious side effect like cardiovascular or cardiac arrhythmias. Physostigmine is a drug of choice. And the seeds resemble like chili seeds. So Datura seed is a brother of chili seed. It resemble each other. So these chili seeds are, instead of chili seeds, they use Datura seeds, especially in the train, long journey train, or sometime in the bus station, railway station, crowded places. So they mix this Datura seeds with the food, maybe roti, chapati, curry, egg curry, whatever curry that is. Okay. After taking that, the person becomes totally deliriant, totally confused. That gives opportunity for robbery, sometime kidnapping, sometime some cheating, theft, or sometimes sexual assault, child kidnapping, or sometimes death also. That's why Datura is a road poison. Write in the chat box. Datura मतलब road poison है. ये road poison है. Road मतलब road side नहीं. Road मतलब it is used by the criminal basically for the purpose of kidnapping and the robbery. Basically for robbery. Okay. लॉल मेकर, बहुत बढ़िया लॉल मेकर. हाउ आर यू? लॉल मेकर? समझ में आ रहा ना आपको? लॉल मेकर. दतुरा सीड्स है ना, चिली सीड्स जैसा है. तो चिली सीड्स आर सिंगल एज्ड है, बट दतुरा सीड्स आर डबल एज्ड है. ठीक है. नाउ याद रखना पड़ेगा 9D मैनिफेस्टेशन. What are 9D? D for dry hot skin. Dry hot skin. Totally dry. Dilated pupil. D for dilated vessels. Delirium. Dermatitis. Dysphagia. Diplopia. Delusions. What type of delusion? Like muttering delirium, carpolugia and all commonly seen. याद रखना पड़ेगा. A mnemonic है, very interesting mnemonic है. Dry as a bone. Dry as a bone. Hot as a hair. Red as a beet. Mad as a hatter. A very interesting mnemonic. Okay, let's make a song, guys. Dry as a bone. Hot as a hair. Red as a beet. Mad as a hatter. Mnemonic especially to explain Datura poisoning. Drug of choice is isos. I hope you are getting my point. I hope you like my okay song. ठीक है. Yes guys, Tanya Sharma, Bhumika, Srimati. हो गया. So this is about the, and it's also known as Jimson weed, locoweed, angel's trumpet, thorn apple, devil's trumpet. All these are other names of Datura. ठीक है. So if you write this, more than sufficient. एग्जाम में क्या लिखना है बताओ. एग्जाम में लिखना है थॉर्न एप्पल. सीड्स के बारे में लिखना है. व्हाट आर डिफरेंस बिटवीन चिली सीड्स एंड दतुरा सीड्स. फेटल डोसेज 100 सीड्स है. फेटल पीरियड 24 आवर्स है. क्लिनिकल फीचर्स है. 90 मैनिफेस्टेशंस है. तो ट्रीटमेंट प्रिंसिपल क्या है. हायोसिन हायोसाइमिन ट्रेस ऑफ एट्रोपिन है. ट्रीटमेंट क्या है. पहले करना है गैस्ट्रिक लेवल, इसके बाद देना है एक्टिवेटेड चारकोल, इसके बाद मतलब इंजेक्शन करना है फाइजोस्टिग्मिन. इट हैज साइड इफेक्ट्स है सेट. और याद रखना पड़ेगा 9D क्या होता है. D. Dry as a bone, hot as a hair, red as a beet, mad as a hatter. Yes guys, that is okay. Yeah, low. Now this is distinction point. Look at this now. Datura seeds, this is Datura seed, it has embryo curved outward. Okay. Then capsicum seeds, it has inward figure of 6, like this. It is a 6. It is inward. It's like a figure of 6. So figure of 6. All of you write in the chat box. The figure of 6 is basically capsicum. Write this in chat box. This can be Viva question, guys. How do you differentiate between chili seeds and Datura seeds? You can answer brown in color, yellow in color, double edged, single edged, and all. Then also you can mention about one more point. Figure of 6. Examiner will be very happy. Be very happy, I'm telling you. Okay. Capsicum seed. Figure of 6. Okay. Keep writing. Next comes is one more very interesting question. One more very important question. That is Nux Vomica. Nux Vomica is also known as dog button. It is used to kill stray dogs. Why is it known as Nux Vomica? Because it causes vomiting. That's why it is known as Vomica. Nux Vomica. Very poisonous. One seed can lead to death. So this is the plant of the Nux Vomica. This is the Nux Vomica. Nux Vomica plant है. ये क्या है बताओ. Nux Vomica plant है. ये क्या है. Nux Vomica seeds है. Nux Vomica seeds. हो गया. Now, what is the fatal dosage? Fatal dosage है 1 seed. Fatal period है 6 to 12 hours. Up to 24 hours. Mechanism लिखना है. क्या है mechanism? क्या है बताओ. Mechanism is, it is postsynaptic. Postsynaptic है. It inhibits glycine. So glycine is a inhibitory polypeptide, inhibitory amino acid in the spinal cord. When glycine is inhibited, there is increased activity of glutamate. So glutamate activity ज़्यादा होगी. So when glutamate activity ज़्यादा होगी, there will be stimulation. The stimulation leads to multiple contractions. contractions of all the muscles, smooth muscles, voluntary muscle, involuntary muscle, all the muscles. So strychnine Nux Vomica can affect heart also, the cardiac poison also. Basically spinal poison, but it has cardiac manifestations also. Okay, good. Okay. Now one more point लिखना है exam में, tetanus. It will symbol like tetanus. Again, question can be asked, what are the clinical features? The first clinical feature will be some throat pain, stomach pain, abdominal pain and all. Some discomfort will be there. After that, there will be, increase excitation of the muscles. There can be lockjaw, opisthotonus, pleurostotonus, emprostotonus, respiratory paralysis. So that leads to death. Okay? So Nux Vomica याद रखना, फेटल पीरियड 1 सीड है, फेटल पीरियड 6 to 12 आवर्स है और पोस्ट सिनेप्टिक पॉइजन है, ग्लाइसिन इनहिबिशन होती है इसमें. मैकेनिज्म क्या है? इट रिसेंबल लाइक टेटनस. क्लिनिकल फीचर्स क्या है? लॉकजा होगा और क्या होगा? प्लूरोस्टोटोनस, एम्प्रोस्टोटोनस, ओपिस्टोटोनस एंड ऑल. So seeds are circular with a central depression, sometimes hairs also. So can you see here? All these are strychnine. Strychnine. Can you able to identify in exam, guys? Yes, Srimati Shivkumar. Can you able to identify these seeds in the exam? Look at the seeds. Looks like a chips. Looks like a banana chips for me. My favorite, banana chips. सेंट्रल डिप्रेशन है, सेंट्रल ब्लैक कलर है, सराउंडेड बाय दी हेयर्स है. ठीक है ना, याद रखना पड़ेगा एग्जाम में. ठीक है. हाउ इट एक्ट्स फॉर द स्पाइनल कॉर्ड. स्पाइनल पॉइजन है, कार्डियक पॉइजन, कार्डियक मैनिफेस्टेशंस आल्सो. ट्रीटमेंट क्या है? ट्रीटमेंट इज सिम्टोमैटिक, शॉर्ट एक्टिंग बार्बिचरेट कैन बी गिवन. ठीक है. यस. नाउ comes is what are the important clinical features. Clinical features I said already. I'm going to write again because this is very important. 3 important clinical features. One is opisthotonus, pleurostotonus, emprostotonus. हो गया. लॉकजा, respiratory paralysis and death. ट्रीटमेंट याद रखना, शॉर्ट एक्टिंग बार्बिचरेट. Short acting barbiturate. Again, question can be asked, how do you differentiate between tetanus and strychnine poison? How do you differentiate between tetanus and strychnine poison? Like example, here is a tetanus poison, here is a strychnine poison. How to differentiate between the both? Can anyone tell me how to differentiate? Banana chips. Okay, good. That's great. So how to differentiate? Remember, it's very simple. The tetanus incubation period is around 7 to 10 days. It is caused by Clostridium tetani. It produces tetanospasmin tetanolysin. So the clinical feature appears after 7 to 10 days. But Nux Vomica, 1 day. Point number 1. Tetanus, most important finding is lockjaw. The first it involves the lockjaw. Then opisthotonus, pleurostotonus. History will be there. There will be some history. History of delivery, history of neonatal tetanus and all. The history of road traffic accident and all. In strychnine poison, so there will be history of some poison intake, some fruit, orange fruit along with the seed. Looks like orange fruit, है ना? बहुत बढ़िया. Then याद रखना पड़ेगा. In strychnine there will be sustained contraction. There will be contraction like this. But in case of tetanus poison, contraction, relaxation, contraction, relaxation, contraction, relaxation. This is an important point. Remember, tetanus is presynaptic. That's why sustained contraction. Strychnine poison, that's why it is basically alternate contraction and relaxation. Strychnine poison is postsynaptic. That's why it calls sustained contraction for short time only, not more than 1 day. Sustained contraction. Good. And one more, Tanya Sharma is telling, sir, tetanus gradual है. बहुत बढ़िया आंसर है. Gradual onset in case of tetanus, sudden onset in strychnine poison. बहुत बढ़िया. Tanya Sharma is also telling presynaptic. Okay, that's great. And also Menak Datta is telling, sir, consciousness होता है. Consciousness is very well maintained in strychnine poison. till last stage. But in case of tetanus, there can be loss of consciousness in last few stages, okay, or in the beginning also. Okay, so this is about the Nux vomica. Now you need to identify again a case of strychnine poison. What is this finding? Strychnine poison, spinal poison है. What is this finding? This finding, also known as devil smile. इसको बोलते हैं devil smile, contraction of the facial muscle. ये है rhizus sardonicus. Rhizus sardonicus is a feature. Can be seen in tetanus also. Point number 1, devil smile, devil in the body. Then the second one, look at this. This is also very important image. In this, there is a sustained contraction of the extensor muscle as well as flexor muscle. So this is the classical appearance in a strychnine poison. So this is known as opisthotonus. क्या है? Opisthotonus है. Now look at this. Emprosthotonus is sideward bending end. Pleurostotonus forward bending. Okay. So this completes your tetanus poison. I hope it is clear. Guys, Nux vomica is a 5 marks question or usually 3 marks question. It is not a main question in exam. So this completes your third topic, Nux vomica. I hope you understood. So the important topics, arsenic we discussed in detail. After that we discussed about Nux vomica. Then Datura poison. Datura is a favorite of examiner. Okay. Yes or no, guys? Yes or no? Okay. The next question is opium poison. Very important question. 3 marks question. What are the clinical features of opium poison? So the plant here is Papaver somniferum. What is this plant? Papaver somniferum. Point number 1. So what are the substances produced by Papaver somniferum? Usually morphine. Diacetyl morphine is semi-synthetic, that is known as heroin. Okay. What is this basically? It's the opium. Opium is a drug of abuse. It causes very high dependence, psychological dependence and physical dependence. So this property is used in kidnapping, child trafficking, women trafficking, and many cases. Opium is very bad because it leads to very high physical dependence, very high psychological dependence. So one who is addicted to opium is totally out of control. Okay? It's dependent. We call it as cold turkey. The withdrawal symptoms of opium is known as cold turkey. The word is cold turkey. Well, if I write in the chat box, cold turkey is equal to opium withdrawal. Cold turkey, cold. Those who are suffering from opium withdrawal syndrome, so they are cold, emotionally disturbed. Turkey because moisture, lacrimation and all. Cold turkey is the name given to opium withdrawal syndrome. What are the clinical features of opium poisoning? Opium poisoning. Remember 3 important features हैं. तो opium poison में होता है constricted pupil. इसको बोलते हैं pinpoint pupil. Pinpoint pupil, small pupil. Pinpoint pupil can be seen in alcohol poison, other poisons also, barbiturate poison also, organophosphorus poison also, but classically in opium poison, very small pupil. Second thing, it also causes respiratory depression, it causes apnea, depression. That's why it is contraindicated in head injury. Morphine contraindicated in head injury. Then it causes coma. High dose causes narcosis, coma. It's a triad of opium poisoning. The management Normally done is Mercury test and other tests also nowadays. Treatment of choice, naloxone, naltrexone. Naloxone is short acting, naltrexone is long acting. Methadone, methadone used in opium addiction. Medico-legal importance, MLI. MLA क्या है बताओ? MLA है, it causes very high dependence, drug abuse, drug of abuse. It's also used in infanticide, the ideal infanticidal agent. Injected to the brain, to the fontanelle, anterofontanelle, posterior-fontanelle. ठीक है? So drug abuse, infanticide, kidnapping, rape, party drug. So we can write so many things, right? Okay, now try to memorize one more important point. There's a legal cultivation in some states. Legal cultivation, because morphine is used in cancer pain also. It's a medical drug. It's a good drug actually. It is used in cancer pain or severe pain disorders. Gazipur, Uttar Pradesh. So there is a legal cultivation. And remember, cultivation of this plant is seriously punishable as per the Act NDPS. याद रखना NDPS. What is NDPS? NDPS, New Delhi Police Station. No, it is not New Delhi Police Station. It is Narcotic Drugs and Psychotropic Substances Act 1985. As per this Act, consumption, cultivation, storage, sale, everything is a punishable offense. Again, it is classified into small quantity, medium quantity, large quantity. The punishment can be 20 years of imprisonment, life imprisonment, or repeat offender death sentence also, as per NDPS. I think this is more than sufficient to, to get 4 marks out of 5. Infanticide and all. Okay, any doubt in this, guys? Tanya Sharma, New Delhi Police Station. Okay, बहुत बढ़िया. श्रीमती शिव कुमार, ये ओपियम विड्रॉल, कोल्ड टर्की. कौन सा सब्जेक्ट है? मेडबेलॉल, forensic medicine. Srimati Shukumar, okay, great. Codeine is a cough syrup. Cold, okay, Rakesh. Hope you are enjoying the class. Okay, बहुत बढ़िया. Now look at this. What is this? This is basically meiosis. Question can be asked, meiosis caused by? One is Opium poison. The second, Organophosphorus poison, that is Opium poison, already I said. Opium poison, barbiturate poison, alcoholic coma, even chloral hydrate also. Midriasis caused by? One is favorite question, Datura. एक और है cocaine poison, atropine poison. So midriasis, 3 marks question. 3 marks per exam. Okay. Brain trauma, epileptic coma, uremic coma, very good. Rudra Gauresh, very good answer. Okay. So this is midriasis. Datura याद रखना पड़ेगा. Datura, devils, that is devil's apple, thorn apple. Okay. Okay. Now one more question asked in the exam is ethyl alcohol. Ethyl alcohol drunkenness certificate is a 10 marks question in practicals. How to write drunkenness certificate? How to interpret the drunkenness? Under the influence of alcohol, not under the influence of alcohol. Very important question. Preparations of ethyl alcohol. stages of alcohol and medico-legal importance. Now look at this, guys. What is this stage? I mean, identify what is this stage. So this man is totally disturbed. Okay, this is talking nonsense, and his gait is also abnormal. Abnormal gait, abnormal behavior, loss of control. Yeah, what is the interpretation? Is it a stage of excitement? Is it a stage of incoordination or stage of narcosis? Three options hai. There are three stages hai. Stage of excitement, option A. Option B, incoordination. Option C hai stage of narcosis or sleep. There are three stages in simple word. My question is very simple. Is it excitement stage, incoordination? Definitely not sleep. You can look at him. You can look at the eye. There is a nystagmus is there. So, misconduct in public by drunken person. Stage of incoordination. Very good. Excellent. So, many answered. Manak Datta, I think, yeah, Tanya Sharma, great. What buddy. Now, legal limit of alcohol, you can write 30 milligram percentage in exam. There are three stages. Like this, you can write. So, there are three stages are there. Stage of excitement, 50 to 150 milligram percentage. Stage of incoordination, 150 to 250 milligram percentage. Stage of coma, more than 250. This is 3 marks question. Stage of excitement, what happens in stage of excitement? Inhibition of inhibitory center. Inhibitory center. Inhibitory centers are in the brain. They are inhibited in the stage of excitement, so there will be apparent stimulation. The person looks very confident. He looks very confident in driving, very confident in talking, very confident in arguing. You must have seen many people after taking 1 or 2 pegs, they are going to, act like they are confident. So it's because of stage of excitement, because of inhibition of inhibitory center. So they look like well-being and all. Disclose secrets. Disclose secrets. Sometime they're going to start, about their own stories in life, old incidents, old relationship. So I was like this. You are like this. You are a waste fellow. I'm a best fellow. Like that. So he must have, must be having a stage of excitement. Disclose secret, all the secrets. It's very interesting. Excessive talkativeness, laughter. Yeah. Excessive talk. Rudra is telling very good. Excessive talkiness. Well, keep on talking because excitement है ना, control नहीं है इसलिए. और क्या है, laugh. Okay, ठीक है. Keep on laughing. ठीक है, बहुत बढ़िया. ठीक है. Disinhibition, no inhibition है. No inhibition at all. Yeah. Good. Then Motor Vehicle Act, yes, he becomes very, very confident. For example, I am normal person. So I am driving my car. I apply my car brake at say 100 meters. Say some 100 meter is my limit. So I'll keep my distance 100 meter. So because that is my safety limit. So I'll apply my brake within that is 100 meter. But here in drunken person, no, they are very confident. They apply brake at 30 meters. That's why there is high risk of road traffic accident, high risk of sexual assault, high risk of indecent assault. So many things are associated. So this is very, very dangerous. The stage of excitement is very dangerous. Why dangerous? Road traffic accident. All of right? Stage of excitement is very dangerous because it is associated with road traffic accident. So legal limit is 30 milligram percentage. Anything more than 30, the punishment can be imprisonment, or it can be fine, or it can be jail also. So I hope you understood stage of excitement. Okay. Super volatile, overconfident. Okay, बहुत बढ़िया. Sham, okay, Sham is answering very well. That's good. Then stage of incoordination. Drunken gait, gaits, total incoordination. Romberg test is positive. इसको बोलते हैं Romberg. Romberg test is positive. Straight line walking test is abnormal. Straight line walking test, that is abnormal. Finger nose test, abnormal. Finger test, abnormal. There can be overshooting, undershooting. So that shows that he is under the incoordination. 150 to 200 milligram percent. Then comes the stage of coma, 250 milligram percentage. So leads to sleep. Okay. I hope you understood. Okay, guys. So you must have seen in Dhurandhar movie, the interval scene of Dhurandhar movie. Interval scene, you know, Ranveer Singh movie, no. So in Dhurandhar movie, no, in that also there is one scene of taking alcohol. Then he's going to kill his one friend. मेरे घर में आंखें, मेरे घर में आंखें, हिम्मत, ऐसा कुछ डायलॉग है, आपको पता होगा, है ना? That shows probably stage of excitement. Okay. Tanya Sharma is very good answer. Chalo, next comes is Messivan sign. What is Messivan sign? Messivan sign. Messivan sign is basically to diagnose alcoholic coma. Very interesting sign, alcoholic coma. So in alcoholic coma, pupil is constricted. Try to understand, pupil is constricted. But on painful stimulus, there will be dilation of the pupil. So like this, slapping, like this. Do some pinching also, like this, pinching. So there will be dilation of the pupil. So normally it is constricted, on painful stimulus like this, dilated and returns to normal. This is known as positive Messivan sign, classical of alcoholic coma. याद रखना पड़ेगा. Messivan sign मतलब classical of alcoholic coma. It differentiates from other coma conditions. Coma can be caused by opium also. Yes, please answer this right. Good. Slapping causes mydriasis. बहुत बढ़िया. Excellent answer. Excellent. Good. What is the fatal dosage? The question can be asked. The fatal dosage. At this fatal dosage is from the standard textbook. It is showing 150 to 250 ml of absolute alcohol. Fatal period is 12 to 24 hours. Cause of death: respiration, respiratory depression, and all. Aspiration also. I hope understood stage and signs and symptom. Then the question is from one of the student. I think some student is asking. Tanya Sharma is asking, sir, how to write consent for drunkenness certificate? See, when he is drunk, when he is arrested person, consent is not required. But consent taken from drunken person is invalid. So in case of arrested person, no need of consent, you can examine. Or else you can ask the police officer to arrest the person, then undergo the test. But consent taken from alcoholic person, the person under influence of any drug, it is totally invalid. Examining patient without consent amounts to assault. So this is very confusing and very tricky condition. Either he must be arrested or forceful examination. You don't do any forceful exam. You wait till arrival of the police officer, then you can examine. Okay? Yes. Good. Menak Datta. Tanya Sharma, have you understood this? Understood. Tanya Sharma asked me one important doubt. Hope you are enjoying my class today. Now comes is what are preparations of alcohol. There are many preparations are there. What are these preparations? One by one. Can you answer, guys? Answer these preparations. A क्या है बताओ? A, B, C, D, E, F. In simple word, so the beer is the preparation consists of around up to 10%, up to 8%, 6 to 8%. Beer has 6 to 8%. Old monk, old smuggler and all, basically whiskey and all 40%, 40 to 50%. Usually 42, 44, sometimes 39. So they are known as horn drinks. This whiskey, rum, vodka and all. Then what comes is wine. So wine basically around 25%. I'm not wrong. Champagne is also around 10 to 12 percentage. All these are preparations are there. Okay. Then comes is, look at this. What is this now? Look at this man. This man arrested by police officer. Arrested. He's drunk. He's drunk. And he was driving the vehicle. Or he was doing some misconduct with the females after the party. He was arrested by the police. Look at the eyes. Eyes showing nystagmus. Nystagmus is there. What is the alcohol level? Alcohol level. Can anyone guess? What is the probable alcohol level? Consent is not required. When arrested person, consent is not required. Consent taken from drunken person is invalid. Okay? It is basically alcohol की nystagmus 80 milligram percentage. Probably 80 milligram percentage. 80. That means 80 means stage of, is it stage of excitement or stage of incoordination? It's a borderline probably. So it's stage of excitement, also stage of incoordination. Both are there in this country. 50 to 150, बहुत बढ़िया. 52. Excellent. So what are Widmark formula? Just write, go through. And this is also a very important treatment of alcoholism. Disulfiram, the 3 marks question. Disulfiram is a drug of anti-abuse. Dosage 250 to 500 milligram 1 to 2 weeks. 125 to 250 milligram per day for 3 to 4 weeks. So when person takes alcohol along with disulfiram, there can be sweating, abdominal pain, palpitation, giddiness. You can also give citrated calcium carbamide in alcoholism. Metronidazole also can be tried. The metabolism of ethanol, ethanol converted into acetaldehyde, acetaldehyde is converted into acetate by an enzyme known as acetaldehyde dehydrogenase. Disulfiram going to inhibit ADH enzyme. Omeprazole inhibit the alcohol dehydrogenase enzyme. This is MCQ, very commonly asked. Okay, all of you write in the chat box. Disulfiram is equal to inhibition of ADH. Write this in chat box. Disulfiram inhibition of acetaldehyde dehydrogenase. Aldehyde is there, no. Aldehyde, aldi matlab that is disulfiram. D for aldehyde. D for D, aldehyde. Omeprazole, O is there, O for alcohol. Okay? Alcohol dehydrogenase. Very confusing. Omeprazole, O is there. 2 O's are there. Alcohol dehydrogenase. Disulfiram, D is there, aldehyde. So that is basically disulfiram. Okay? MCQ, very commonly asked. I hope understood. And Rakesh, and able to write in the exam. Yes, Rakesh. Are you there, Rakesh? Tanya Sharma. Dipesh. Okay. No, Bhumika, no, Dipesh. We have good students. We have 3rd year MBBS students. I can name them. Tanya Sharma, Srimati Shukumar, Rakesh, and Menak Datta. They are all 3rd year hard-working students. They are my friends since last 8 classes. Salute, a big salute, guys. Very big salute. You are awesome. Chalo, ho gaya. Yes or no, guys? Shall I skip this? Alcohol, I think you can write. Alcohol, you need to write all this. Okay, what are the preparations of alcohol? Alcohol is a CNS depressant. There are 3 stages are there. Stage of excitement, incoordination, stage of coma, ho gaya. And fatal dosage, fatal period, cause of death, ho gaya. Massive unsigned लिखना है. इसके बाद horizontal gaze nystagmus लिखना है. इसके बाद investigation लिखना है. Widmark formula, treatment, metabolism, and also disulfiram. If you write, you will get 4 out of 5 for sure indeed. 4 out of 5. Okay. Then comes this methanol poison. See, ethyl alcohol is good. Ethyl alcohol is basically bad only. Its alcohol is bad. But methyl alcohol is very bad. You must have heard one dialogue, you are bad, I am your dad. So ethyl alcohol is bad, but who is the dad of ethyl alcohol? Methyl alcohol. Methyl alcohol is the dad. So you can write Methanol is very toxic. The fatal dosage is 60 to 200 ml. Very bad man. Methanol is a very bad man because he's a dad of ethyl alcohol. No. Yeah, I hope you're understanding. Then fatal dosage, fatal period, you can write 24 hours. What are the clinical features? Clinical feature याद रखना पड़ेगा. Blindness. So methyl alcohol affect the retinal now, affect the retina. It causes blindness. It causes visual field defects, scotoma and all. It also causes coma. It also causes smell of alcohol. Smell of alcohol. This is classically known as Hooch tragedy. Hooch tragedy. All of you write Hooch tragedy is equal to blind drinkers. Blind drinkers. Right, mnemonic. Hooch tragedy. Hooch मतलब basically acid है or aldehyde है. So Hooch tragedy is methyl alcohol poison when methyl alcohol is mixed with the ethyl alcohol. Some amount of methyl alcohol, maybe 30 ml, 20 ml, mixed with the ethyl alcohol. Smell is same. Maybe it is light bitter than the ethyl alcohol. It leads to blindness. It leads to drowsiness. It leads to coma and death. It also can lead to point and hemorrhage. Blind drinkers is the name given to Hooch tragedy. याद रखना पड़ेगा. ठीक है. Rudra Gauresh, okay. Methanol is converted into formaldehyde. Formaldehyde converted into farric acid. Formaldehyde is very bad. It's a very bad. Formic acid is also bad. They are very bad people. Because they act on the CNS, they cause coma. They also affect the optic nerve, leads to blindness. What is the enzyme? Here alcohol dehydrogenase. Here enzyme is aldehyde dehydrogenase. Same, metabolism must be knowing. Alcohol is converted into aldehyde, aldehyde converted into acid. So formic acid, formaldehyde, formic acid, they are bad people, very bad people. So the treatment is fomepizole, or else you can give ethyl alcohol. Ethyl alcohol. What is the drug of choice? The drug of choice basically ethyl alcohol or fomepizole. Yes, so this is what you need to remember. ठीक है, याद रखना पड़ेगा. For example, how to give ethyl alcohol? Anyone can you answer? How ethyl alcohol is given? Is it given orally, or it is given intravenously or intramuscularly? Can anyone tell me? What is the route of giving ethyl alcohol in case of methyl alcohol poison? Say example, I am in particular city, a remote city, in a night, in a condition where too many patients are there, hospital facility is not there. So I suspect methyl alcohol poison. Time is very important. So can anyone tell me how to treat them? There are 10 patients are there, or 10 people around me. I am away from the hospital setup. How can I treat methyl alcohol poison? By giving ethyl alcohol. My question is how to give ethyl alcohol orally or intravenously, intramuscularly, or what to do? Anyone? Dipesh is telling orally. Dipesh, very good. Dipesh, Tanya Sharma giving okay. Very good. You can give orally also. You can mix with the maza juice. Instead of giving whiskey, you can tell, okay, bring some maza. You can mix some 100 ml of whiskey and give it to them. That is an emergency. Or else, in the hospital setup, you can give ethyl alcohol intravenously. Okay, so this is very, very interesting MCQ. Very, very interesting Viva question. So orally in emergency and hospital setup, it is given intravenously. Then level maintained all the time, 150 milligram percentage. At this 150 milligram percentage, ethyl alcohol saturates this enzyme, alcohol dehydrogenase enzyme. It prevents the formation of formaldehyde formic acid. This is the summary of the treatment. Ethyl alcohol or the basically fomepizole. I hope you understood. Methanol, 5 marks question. If you write this, more than sufficient. What are the clinical features? I said already. Postmortem finding: pontine hemorrhage, brain hemorrhages, retinal hemorrhages, congestion of the organs, petechial hemorrhages, cyanosis, respiratory paralysis and death. Okay, बहुत बढ़िया, ठीक है रुद्र गौरेश. Better how to revise from ready fast. I think it is better to go through the notes provided by us, PDF file. That is more easier than reading textbook, I feel. Okay. Now look at this. What is the finding here? Now I am in the Shava Pariksha room. I am in the postmortem room as a forensic expert. A case of huge tragedy. I am examining brain. I can see the white matter there, grey matter there. So I can see some findings here. What are the findings here? Anyone can identify? Now you are forensic expert. You can see the thalamus there. Thalamus is there. Cerebellum is there. Brainstem, midbrain है, corpus callosum है, sulci है, gyre है. My question है, answer क्या है? What is the finding here? Come on, guys. Come on. Try. Huge tragedy. Okay. Srimati Shivkumar. Beta, what is this? So this is basically spontaneous hemorrhage or brainstem hemorrhage. So it is basically brainstem. This is cerebellum, you must be knowing. So this is basically white matter. This is grey matter. You can also see petechial hemorrhages. Okay, you can just petechial hemorrhages over the thalamus also. So can you make out the petechial hemorrhages, guys? Can you make out? Petechial hemorrhages are there everywhere. Okay, and there are findings of herniation also. Corpus callosum, ventricles. Can you make out petechial hemorrhages? This is how we are going to examine brain in case of huge tragedy. Yes or no? Okay. Next comes is, this completes today's most important question. Now I have some 10 questions are there as usual, 10 important 3 marks questions like this. Forensic short answer, like an interactive session. Like a interactive session, like a chocolate session we call it as. Anyway, it's an online class. I can provide you only 3D chocolate. Okay. So not the dairy milk, only 3D chocolates. Are you ready for the next session, guys? Forensic short answers. Are you there, Tanya Sharma? How is the Josh in forensic class? How is the Josh? It must be very high in all the classes I said in the previous class. You can make yourself awake. You can make me awake also. Forensic short answer. Ready, guys? Yes or no? Ready? I'm ready. I'm ready. Totally ready. Tanya Sharma ready. Manak Datta ready. How is the Josh? High. Rakesh's stallings are very high. So high of energy. Yeah. Very good. Josh is high. Tanya Sharma's stallings are Josh. Stage of excitement. Very high. बहुत बढ़िया. Srimati is telling sir. Yes sir. Hi sir. Manak Datta. Manak Datta is one of the very sincere student in all the classes. Manak Datta, hats up to you. You are very sincere. Okay. Great. Rudra Gauresh is telling sir. Yes sir. Ready. Rudra Gauresh. Great. The first question, 3 marks question, is this question. Pakka question in exam. So gastric lavage tube. My question is, what are the contraindications for gastric lavage? Look at this question. Gastric lavage. It has a suction bulb, funnel, mouth PVC is there, a rubber tube is there, it has proximal and distal end. So my question is very simple. What are the contraindications for gastric lavage? Gastric lavage is done in most of the cases of poisoning except some condition. What are the contraindications? There are 2 types of contraindications. Relative contraindication, absolute contraindication. What is the absolute contraindication? Yes, very good. First to answer by Rakesh, very good answer. Srimati, good answer. So, corrosive poison, corrosives, except carbolic acid. Carbolic acid hardening of the stomach, it is not a contraindication. That is absolute. Other condition like kerosene poison, strychnine poison, okay, convulsion is there, bleeding diathesis, bleeding is there, variceal bleeding is there, hypothermia, there are many indicators, pregnancy. Okay. So, absolute is corrosive. So, first answer by our student Rakesh and Srimati. Great answer, Rakesh. Rakesh, very good. Second student, Srimati Shukumar. Srimati. Good. Gastric lavage is done in left lateral position. याद रखना पड़ेगा. Gastric lavage is done within 24 hours, ideally within 4 hours. What are the names of the tube? Avoid's tube, Bose tube, Riles tube, Evine tube. Names of the tube. What are the parts of the gastric lavage tube? That can be viva question. How to confirm that gastric lavage tube within the stomach, not in the respiratory tract, by using auscultation. All these are commonly asked. 3 marks question, pakka question. Pakka. Okay, good. Next. Now this is very interesting question, guys. Identify these seeds. The seeds are very shiny. They have brown markings are there. It looks like a tick. Brown black markings are there. Tick जैसा है, brown color की है, shiny है, very poisonous है. It consists of ricin है. Category B, agent of bioterrorism. It is used in umbrella murder case. It inhibits protein synthesis. Okay. Fatal dosage 10 seeds. Fatal period 3 to 4 days. So it is used in homicide. Now I hope you got the answer. So what is the answer for this? Answer है castor seed. Castor seed. Scientific name है Ricinus communis. Okay. Good. The first answer by Rachel. Beta, very good, Rachel. Excellent answer. Good. Castor seed. 3 marks question. Simple question. And write. Hope. Now, very interesting question. Here is the painter. Okay, he is basically a painter. Came with a history of constipation. Constipation है, पेन है, दर्द है, मोशन की प्रॉब्लम है, पेंटर है और फेशियल पैलर है, फेशियल पैलर, अनीमिक है, और फाइंडिंग है, हम फाइंडिंग is Bartonian line. What is this Bartonian line? Bartonian line, the answer is lead poison because of lead sulfide. known as painter colic, Saturnism. Okay? So it is also known as Saturnism, plumbism, lead poisoning can lead to encephalopathy in children. So lead poison, very important question. So after the class, go through lead. Lead can be main question also. Burtonian line. Good. That's great. One more important finding, basophilic stippling याद रखना पड़ेगा. Basophilic stippling. Next question. Next question is, husband came with a history of Aldrich means line. Aldrich means. Okay. He suspects some poisoning. Suspect arsenic poison. Some poison mixed with the water every day, given by his partner. So as a clinician, when you examine the hands, what is the finding? So the finding is raindrop pigmentation. Raindrop pigmentation. Good. Very good. Now look at the video. Very interesting video. A case of infanticide. The lungs are taken out. The lungs are kept within the water. You can see here lungs are floating. Lungs are floating. That means air is there. Is it live birth or stillbirth? A case of infanticide. To rule out decomposition, the liver is also compared. Normally liver sinks. You can see here this video, lungs are floating, pieces of lungs also floating. That means air is there. That means breathing is there. My question, live birth or still? Again, there are true positive condition, false positive condition, false negative condition. False positive, like example, decomposition. False negative, like example, atelectasis, lung collapse syndrome. What is your inference? Is it live birth or stillbirth? A case of newborn death, infanticide. So it's a hydrostatic test. I agree with that. That is a 5 marks question. The question is, now look at the liver. The liver is also kept. The liver is sinking. Liver is sinking, lungs are floating. Lungs are floating, liver is sinking. What is your inference? Come on, guys. This is hydrostatic test. I agree with that. Hydrostatic test. Known as Regod test. Regod test. Try to memorize. Sinking means stillbirth. Floating means live birth. The control is liver. Good. So this is stillbirth. Live birth basically. Floating है ना, live birth है. Hope you are understanding, guys. Now see, long back when I was working in Delhi, when I was working in Maulana Medical College, New Delhi, found a case of infanticide. A case of feticide. During postmortem examination, we do one common test, hydrostatic test, Regod test. Just take out the lung, keep it in the water. If it is floating, then it is live birth. If it is sinking, stillbirth. Then take out the lung again, cut into multiple pieces. So try to remove the air, as much as air from the lung pieces. Then you keep it in the water. Then still if it is floating, then it is live birth, because look, the residual volume, you must be knowing residual volume in the lung is around 1200 ml in the adults. So residual volume makes the lung floating in the water in case of live birth. So this is the funda. So many cases. So many cases during my experience, more than 10 cases, infanticide and examination. Commonly do in the postmortem room, शव परीक्षा room. समझ में आ रहा है ना? तान्या शर्मा, राकेश, are you there guys? Are you there? Are you sleeping guys? Are you there? Are you sleeping? Okay. So 5 question. 5th question is first question I think gastric lavage 3 marks question है, castor seed 3 marks question है, Bartonian land 3 marks question है, renter pigmentation arsenic 3 marks question है, hydrostatic question is 5 marks question, infanticide. ठीक है. Now next question is, look at this question. Here is a case of 22-year-old male came with a history of liver cirrhosis. Liver cirrhosis, multiple nodules are there, the liver during ultrasonography, totally distorted shape. Then during eye examination, jaundice is there, jaundice. And further examination, KF rings are there. So KF ring is there. Point number 1, liver problem है, jaundice है, non-alcoholic है, can be genetic condition also, can be Wilson disease also. Okay? My question is, what is the poisoning in this condition? This is acute poisoning of copper. Copper poison. Copper poison, we see Clapton line also. Clapton line. One more point, MCQ. Vineyard sprayer lung disease. Vineyard sprayer lung disease. Copper poison because of the inhalation of the copper fumes. Important question. Copper, copper, copper. Manak Datta, Tanya Sharma, good. Shivati Kumar, excellent. Now look at this scenario, very interesting scenario. Here is a patient came to hospital along with the snake, history of snake bite, along with the snake. Look at him, he is carrying snake. It seems to be a poisonous snake. This is a probable snake. My question is very simple, guys. Is it poisonous? Identify the snake. Look at the head, triangular head, constricted neck, broad body, pointed tail, hemotoxic. Hemotoxic. Point number 1, hemotoxic. Point number 2, ATBT abnormal. 20 minutes whole blood clotting test is abnormal. Bleeding hai, vesications hai. Now what is this snake bite? This snake bite is viper bite hai. Viper इसमें है Russell's viper. See the brown spots है body में, body पर brown spots है, Russell's viper. Hemotoxic है, death occurs in 3 to 4 days, hematuria, kidney failure, all these are clinical. Hemotoxic, Russell's viper. So Clapton line is green color line. Green color line over the gum, teeth and gum line. Okay, at the junction of the teeth and gum, green color line. Okay, treatment is ASV, discussed many times. आगे देखते हैं 8th question. 8th question is also a very interesting question, guys. Very nice question. 3 marks question. The patient is having bat wing tremor. Bat wing tremor. Patient is also having KF ring. Autosomal recessive condition. ATP7B defect. Accumulation of copper in the liver, in the anterior lens capsule. ये क्या है? 1. So this seems to be Wilson disease. In forensic, remember, Wilson is equal to copper poison. The copper sulfate is known as blue vitriol. Blue vitriol. Again, one more very commonly used agent, and death occurs. Blue color discoloration of the stomach, intestine, everywhere blue vitriol. So vitriol is basically oil of vitriol, that is sulfuric acid. Blue vitriol is copper poison. Batwing tremor, मेहनत दत्ता, excellent. आगे देखते हैं. Now look at this. It's a very interesting video. Already we discussed in the first slide. What is the contraindication for this procedure? What is this procedure? Just identify what is this procedure. Look at this. Gastric lavage tube hai. Gastric lavage, funnel is there, proximal end, distal end, mouth gag. So distal end has two openings. Yeah, basically for the evacuation of the stomach pumping in left lateral position. Commonly done in case of poisoning, except corrosive poison, except sulfuric acid and others. Carbolic acid you can do. Gastric lavage tube. Okay, good. That's great. And the last question. The last question, very important question in P and SM also. P and SM, there will be one question from endemic ascites, latheriasis, epidemic dropsy. Now in forensic, I have a question for you. Look at this plant. This is having spiny projections. We call it as pricky poppy. Pricky poppy. What is the plant? What is the clinical condition? This plant is very poisonous, which causes epidemic dropsy. Epidemic dropsy is clinical condition. The mixing of seeds of this plant with the mustard seed. The active principle is, anyone? Sanguinarin. Sanguinarin. It increases venous permeability, causes ascites, causes edema, causes glaucoma, and it causes cardiac failure and death. What is the plant? The plant is Argemona mexicana. The plant name? Argemona. Argemona mexicana. Argemona mexicana. Mexicana. Yeah, खाना नहीं है. Mexicana is bad. खाना नहीं. What is the scientific principle? Sanguinarin is bad. Leads to edema and glaucoma and all. याद रखना, endemic ascites is caused by pyrozolidin. MCQ. Then one more is latheriasis. Basically, beta oxalyl aminoalanine. Latheriasis. Kesari dal. Consumption of kesari dal as a staple diet can lead to latheriasis. Three conditions very commonly asked. Endemic ascites, latheriasis, lastly Argemona mexicana. Okay. Hope you understood this plant. Okay. Now I have one more question today, because I haven't discussed FARRE ballistic question in the class, especially the range of ballistics. Now look at this. Now you need to identify the range. See, the range of ballistics, basically it can be contact entry wound, close entry wound, or it can be sometime near shot, distant shot and all. In contact entry, there will be cruciate entry wound. So my question here, look at this. So imagine this is a hypothetical example. Look at this. Skull hai, Can anyone identify what is the range in this? Range. Here they go. Like this, like this, like this. What is the range? Here, very simple, it is contact entry wound. In contact entry wound, the finding is cruciate shaped entry wound. Cruciate. There will be muzzle imprint. Muzzle imprint. Okay. Then stellate shaped entry wound. Blackening, tattooing, and all usually absent. They are present, are usually present within the track. Innertable beveling will be there. Okay. So this is contact entry wound. This is close shot. Well, if you understand, up to 9 centimeter, it is close shot. Close shot. Up to 9 centimeter. 9 to 60, 9 to 60 centimeter, like this. Near shot. Near shot. More than 60, we call it distant shot. Distant. There are 4 ranges: contact shot, close shot, near shot, distant shot. Commonly asked in the range, commonly asked. So, common cause of death in case of firearm injury, basically shock and hemorrhage. Death occurs within seconds. Chalo. Okay. Any doubt, guys? Any doubt in forensic ballistic? You want me to discuss forensic ballistic? Anything? Any doubt in forensic medicine? You can ask me. So, this is the contact shot. This is the close shot, near shot, and this is your distant shot. So this is the. Can you identify this firearm? Okay. What is this firearm? Okay, revolving cylinder is not there. Revolving cylinder there. Is it pistol or revolver? Look at this. Identify. It's a dummy. Okay, dummy gun hai. Okay. So it is basically pistol. The range is 100 meter. It has a barrel. Must be knowing. It has a grip. Grip is there. Handle is there. Trigger guard. Trigger is there. Okay. Magazine. Mirror. This is the barrel. If lance and grooves are there, then it is rifled weapon. Try to memorize. Lance and grooves are there मतलब rifled है. Rifled मतलब lance and grooves है. कहाँ पे है? Barrel में है. Lance and grooves नहीं है, circular है, smooth bore weapon है, मतलब shotgun है. याद रखना पड़ेगा. So all of you write in the chat box. Rifling is equal to lance and grooves. Please write. Rifling is equal to lance and grooves लिखना है. It's very good. Rifling means more accuracy, more range, more penetration power, more velocity. Okay? Again, choking can be 3 marks question. Choking in shotgun. Shotgun is smooth bore weapon. The constriction of the barrel in the muzzle. Okay? It has 2 sides, muzzle imprint and muzzle side and the base side. Can souvenir bullet chronic lead poisoning? Yes. Souvenir bullet can lead to chronic lead poisoning because bullet is made up of lead. One of the rare cause of lead poisoning nowadays. Okay? Yes. Now, one more question very commonly asked: what is the what is the structure of shotgun? Structure of shotgun we discussed in previous class. Shotgun. Okay, याद रखना पड़ेगा. Then sometime question can be asked: what are bullet markings? What are primary bullet marking? What are secondary bullet markings? 3 marks question. A question can be asked about gunpowder, black gunpowder, smokeless gunpowder, semi-smokeless gunpowder. That is very simple and very fact-based question. How to detect gunshot residues? Thermal nitrate test, neutron activation analysis, other tests as well. Okay. NAA and all. ओके, बहुत बढ़िया यार. कृष्णा फाइनेंस इज टेलिंग सर, गैंगस्टर ऑन द टॉप. हो गया. One more question is there. Now look at this question. What is this? Identify this. This plant consumption of this seeds can lead to latheriasis. Latheriasis. Anyone identify this? Latheriasis caused by, once again, go through this video. Looks like a dal. दाल जैसा है बट दाल नहीं है. ये केसरी दाल है. केसरी दाल है. केसरी दाल चटनी है. Consumption of this because of the BOAA causes paralysis. क्या? तो चटनी causing केसरी दाल चटनी causes paralysis. What are the types of paralysis? Single stick stage, double stick stage, crawling stage, and death. There are 4 stages are there. Single stick, double stick, crawling, and death. So kesari dal is bad. Good. Many answered. That's great. बहुत बढ़िया. आगे देखते हैं. Look at this now. This is a poisonous substance. 3 marks question. This is malathion. Anyone identify what is the drug of choice? Drug of choice क्या है? Look at the labeling. Labeling is somewhat yellow color or sometimes red color. Very poisonous. Very poisonous substance. Anyone? What is the drug of choice in this condition? Drug of choice in case of malathion. Alkyl phosphate. Aryl phosphate. Alkyl phosphate. Come on guys. श्रीमती इज टेलिंग सर अट्रोपिन देते हैं हम लोग. अट्रोपिन डोसेज बताओ कितना है? 2 to 4 मिलीग्राम IV देना है. IV till atropinization. Discussed in last class. चलो देखते हैं. Next question. This is very interesting guys. What is the fatal dosage of poison given below? The poison is aluminium phosphide or sometimes zinc phosphide. Very interesting. Recently in Mumbai, there was a case, the case of, case of death. We call it as biryani death. So the family members, all the family members died due to some rat poison. A rat poison. Rat poison was found with the watermelon. So after all 5 members, I think 3 or 4 members, they found dead after a party, some party in the family. All the 3 or 4 died. Then postmortem was conducted. The postmortem hypostasis color was brown color. Brown color. And it was positive for zinc phosphide or aluminium phosphide. It was also present over the watermelon pieces also. My question is, what is the fatal dosage of this? Fatal dosage. To alphos, yes, very good. Alphos poison, very good. 1 to 2 gram, no, but it is not 1 to 2 gram. Even 500 milligram can lead to death. 500 milligram. The 500 milligram over the watermelon leading to death. Remember, it inhibits neurotransmission. Produces poisonous gas in the body. Poisonous gas. This poisonous gas inhibits electron transport chain. Complex 4 leads to histotoxic hypoxia and death. No treatment, no antidote. The interesting fact is no antidote, no treatment. The only treatment is gastric lavage, early diagnosis and gastric lavage. Can lead to hepatic disease, can lead to multiple signs and symptoms. Okay. So this is aluminium phosphide poisoning. Ratol, very, very bad. Yaad rakhna, ratol. Ratol paste. Never keep ratol paste in your house, especially with the children's. In my experience, in my 10 to 15 years of forensic medicine experience, ratol was confused with the Colgate paste. No, paste and ratol, they both are paste. Some amount of ratol paste was taken by the children, some child found dead, brown color postmortem hypostasis, histotoxic hypoxia and death. Ratol and Colgate. Just remember, ratol मतलब कोल, ratol याद रखना, ratol लिखना के बाद लिखना Colgate. Ratol and Colgate मतलब याद रखना, ratol is a rat poison, consists of aluminium phosphate, very fatal, and Colgate is good, but there can be chances of accidental death in children. Phosphine gas, very good, Ganesha. Now next video, there's one more video is there. What is the strangulation shown in the video below? Here iron rods, example, this is the iron rod. One iron rod is placed in the front like this, and other iron rod is placed like this. Okay. What is this strangulation method known as? Come on guys, can identify? Okay. Iron rod is placed, leading to strangulation. What it is known as? This is known as Bansdola. Okay, Bansdola. Good. And the last question. Last question is question from the hanging. Question from hanging. The first day class we discussed, no? One eye is open, other eye is closed. Important 3 marks question. What is this? This is because of compression of cervical sympathetic chain. Cervical sympathetic chain. This is a basis sympathetic. Three marks question. Present on the same side of knot. Can be feature of antemortem hanging. And one more point, try to memorize. In case of hanging, oblique ligature mark. In case of strangulation, transverse ligature mark. Okay. Protruded tongue is a feature. Protruded tongue. The common features are CPC. So congestion, petechial hemorrhages, and also cyanosis. 3 marks question in exam. They face sympathetic. Rakesh, Tanya, Ricky Martin, Manak Datta, Srimati. Great answer. So this completes today's session and important questions. Okay. Yes, Manak Datta, Srimati Shukumar, any doubt? Any doubt in today's lecture? Thank you all. Thanks for your attention. Thanks for your interaction. Yeah. Forensic is not that difficult. Easy. Easy. Go through all the important questions, all important short essays, long answer. So we completed around 8 classes in FARRE. Discussed many important questions. The very important topic today's lecture, arsenic poison. Go through the arsenic poison, important. Then comes is lead poison, important question. If you have a doubt, you can ask me. Go through this. Difference between arsenic and cholera, 5 marks question. Then also important topic is this: dry as a bone, hot as a hair, red as a beet, mad as a hatter. Datura poison, very important. Then comes is your orange. Now apple is thorn apple, orange is strychnine poison, Nux Vomica. Very important. Everything is taught with the help of videos and images, and in between some silly jokes, some silly songs. I hope you enjoyed it. So the purpose of jokes, purpose of songs, basically to help you to understand forensic. Okay, there is no hidden agenda in that. Then स्टिचनिन हो गया, इसके बाद ओपियम पॉइजन याद रखना पड़ेगा, पेपर सोमनिफर. Poppy seeds are non-poisonous. 5 marks question. Very important. Then is favorite question of examiner. Alcohol. Ethyl alcohol. Alcohol is bad. Methyl alcohol is bad. Very bad. Okay? Hope remember. Especially this one, treatment of ethyl alcohol poison. Ethanol, acetaldehyde, acetate and all. Very important. Then comes is gastric lavage, favorite of examiner. Then is castor seeds, Bartonian line, raindrop pigmentation, hydrostatic test. बार पूछते एग्जाम, बार आता है एग्जाम, याद रखना पड़ेगा. Then Wilson disease, copper poison, viper, then batwing tremor, gastric lavage again, Argemona mexicana, kesari dal, discuss kesari dal today, kesari dal chutney, malathion and the drug of choice, aluminium phosphide, rat poison, ratol or Colgate paste, watermelon death, Vance doula, then lay faces sympathetic. Yeah, lay faces sympathetic. Tanya Sharma is asking, sir, Booth Bungalow series. So Booth Bungalow, let's do Booth Bungalow series in practical class. Maybe the day after tomorrow or after 1 or 2. Okay. Mainak Datta, any doubt? Any doubt in forensic medicine? From any chapter we can ask me. Any chapter. Last 2-3 minutes. Okay, no doubt. Thank you guys. Good night. Meet you on some other day with the important FMT practical exercises, like briefly how to write injury certificate, what is grievous hurt, simple hurt, then how to write drunkenness certificate, how to give opinion, victim examination, how to give opinion, accused examination, how to give opinion, then forensics part was very easy. Then along with that, Booth Bungalow series, 10 important very famous post-mortem cases, findings in an interactive manner in 2 classes. Okay. Tanya Sharma is asking how to differentiate images of skull entry exit wound. Very good question from Tanya Sharma. Entry wound, how it looks, right? entry wound, exit wound. So entry wound, inner table is more damaged, more damaged. Exit wound, outer table of skull more damaged. Okay, so example, this is the skull. You know, this is the inner table. This is outer table. In between there will be cancellous bone. Okay, this is the cancellous bone. If outer table is damaged, exit wound. Inner table is more damaged, entry wound. Simple funda. We call it as inner table beveling or outer table beveling. Beveling means damage. Simple word. Not to confuse you. Inner table beveling means inner table is more damaged. I hope you understood. Alcohol percentage are asked. Yeah, alcohol percentage sometime in Viva. Probably Randava. Alcohol sometime asked, not all the time. Some examiner. Just already. Yeah. Simple word. It is beer and hot drink. Yeah. Beer 6 to 8. 8 means strong beer. 40, 30, 35, 40, 40 onwards it is hot drink. Yeah. Then levels also asked about the excitement and all. Yeah. Probably Randava. Last. So this completes our today's session. Thank you all.